So why do we have such alarming rates of cancer? Women, 1 in 2.5 women, men, 1 in 2 men. And it's the single greatest killer for children 1 to 15 years of age. So people always think, oh, my mother had cancer, my dad had cancer. Oh, well, I'm going to get cancer. But guess what? Genetics is less than 3% of cancer. So don't think because your mom or dad have cancer that you're going to get cancer. I'm not saying that that's not possible, but it's just not a strong cause of cancer. So why do we have so much cancer? Well, we have an explosion of chemicals and toxins in the environment. In the food we eat, it's the cover of Discover magazine, arsenic in your food, cadmium in your food. There are an incredible amount of toxins, hundreds of thousands of toxins in our food, in our air, and in our water, everything that we're ingesting each and every day. And you can actually do blood testing to determine if you have chemicals and toxins. You can do blood testing to determine heavy metals. You can do urine testing. There's all kinds of very inexpensive testing. But I can tell you right now that I have never seen a urine or a blood that is not contaminated. Now, one other toxin that you may not have heard about is electromagnetic fields. And some scientists around the world think that that is the single greatest threat posing human beings today. And I tell my children, if they're only 50% right, let's just say they're not 100% right, even if they're 50% right, take some proper precautions because we do know that electromagnetic fields damage the DNA. Now, when we have been diagnosed with cancer, the DNA of a cell has been mutated and changed into a cancer cell. So we might as well do some protective things to detoxify our body and get rid of the electromagnetic fields. Now, the other thing are viruses. Do you know that head and neck cancer, about 30% are caused by the human papillomavirus? So there are herpes virus, there's HIV, there's hepatitis, there's all kinds of viruses, and they drag the immune system down. So there are things that you can do to arm yourself, to protect yourself. First of all, preventing the virus. Second of all, treatment. I'm not talking about treatment with drugs, but to get your body in optimal function so the viruses are asleep. There are Ayurvedic herbs. There's all kinds of herbs to eradicate and decrease the load of viruses in the body. Now, there are other microorganisms in the body, like bacteria, and there's parasites. Parasites, people think parasites, oh, you go to the doctor, no, we live in the United States, it's impossible to have parasites. Well, how are they testing? You know, if you send your stool off for parasite testing, do you know by the time the laboratory gets it, the parasites could possibly be dead? So to make an accurate diagnosis of parasites, you really need to look at the stool within 20 minutes. So making a diagnosis of parasites is very difficult. And you could have symptoms from a headache to a bloated stomach to cancer when you have parasites. So when we look at cancer, we have to look beyond the cancer. Cancer was caused by not one thing, not two things, many different things in the body. And so when you come to see a doctor, an integrative doctor, they're going to look at all the different contributing factors, because you can have 2 patients with breast cancer, but they're different. They're not the same person. And so you can't treat cookie cutter everybody the same. You have to be very individualized and personalize the treatment for each cancer patient. That is why I do genetic testing on my patients. So what is genetic testing? Well, you know, one thing will work for one person and another thing will work for another person. So I use a laboratory called RGCC, and RGCC is stationed in Greece, and they have the ability to determine, first of all, what works on your cancer. Okay, if you want to use a chemotherapy, what really works on your cancer? You don't want to just take whatever the standard of care is, because that might not work on your cancer. In fact, I'll tell you a story. I had a patient who had tongue cancer, and they used 2 different chemos, didn't touch the cancer at all. So obviously that didn't work for her. So we have to really personalize and individualize each cancer's treatment protocol to optimize and get the best cure. But one really important thing I want to tell you about is a discovery that was really just made in the United States in the last couple of years, and that's called circulating tumor cells, circulating stem cells, or more importantly, tumor initiating cells. Now you wonder why. Wait a second. Why is that cancer traveling around and causing metastasis? Well, that's because you have circulating tumor cells. Circulating stem cells are also called tumor initiating cells that are causing 95% of metastasis. So the only way that you have a cure for cancer is when that circulating tumor cells is 0. So if you're diagnosed with cancer, and when I have a patient that comes in and they say, Dr. Keeley, I have breast cancer. My doctor did a lumpectomy, my doctor performed chemotherapy, and my doctor performed radiation. And I want to know now if I have cancer. And I said, okay, we are going to find out. So the first thing that I'll do is do a circulating tumor cells or circulating stem cells blood test. And it will help me determine if they have cancer. And if that number is 0, we have achieved a cure. Now let me tell you a story. I had Mr. Ron come in, and he's 78 years old. And he has been following a very wonderful, beautiful lifestyle, making wonderful lifestyle choices. But unfortunately, he was diagnosed with the big C word. Not only 1 C, but 2 C's, colon cancer. So he says, okay, Dr. Keeley, what can I do? And I said, okay, you want to have surgery because it's been recommended. I said, okay, I'm going to go along with the program, but we're going to do a little experiment. I'm going to check your circulating tumor cells, circulating stem cells before the surgery. He says, okay. And if you're cured when they remove 6 inches of your colon, and I'm going to check your circulating tumor cells, circulating stem cells afterwards. And if you're cured, Mr. Ron, then we have been victorious. So, sure enough, he came back a month later, and we checked his circulating tumor cells. Guess what? His number was about the same as where we started. So I told him, no, Mr. Ron, we don't have a cure, but guess what? I do have an answer for you. So I created a customized program just for Mr. Ron to get the circulating tumor cells, stem cells to 0. So don't be fooled that someone's told you a cure. Make sure you're cured. And in the journals, in the textbooks of oncology, they tell you you only have a cure when that circulating tumor cells is 0.